Hey gang, good morning everybody. Welcome to Intellectual Medicine. Thanks for tuning us in. Today's show, we're going to be talking about getting the lead out, baby. This is a critical topic. Listen, if there was something out there, and in fact there is, that was contributing to 400,000 deaths per year, do you think we should tune in on it, or be aware of it, or endeavor for a means of preventing or reversing it? The answer to all of the above is yes. Then why have you not heard about this toxic exposure that we're absorbing every day that has been shown to contribute to 400,000 deaths, 250,000 cardiovascular deaths? We're going to be talking about that today. We're going to warn you, and remind me, Shannon, to do this. I can't overlook, because I did last week. I told them I'd warn them, and I didn't. 2 antibiotics that can cause death. Now, on top of that, antibiotics have been shown to be ineffective for most forms of bronchitis and upper respiratory infections. So we'll talk about the need to protect yourself from excessive prescribing of antibiotic. We're going to talk about the number one cause of disability in the United States, the sad fact that there's nothing in Orthodox medicine that helps. Nothing. And we'll discuss what alternatives may be available. And we have to talk about this conceptually. We love intellectual medicine. It's very exciting. From our seat, we get to see the frontier of what's happening. We get to bring in to help people right now with conditions that are challenging to them, not the least of which is aging itself. The number one cause of most diseases is chronologic aging. Anything we can do that will change that will be helpful. Are we about to come on?
Your phone. I'm going to use it to type instead of mine.
Okay, and we're about to go. Got to follow the money sometimes, folks. We live ahead of the curve here at Intellectual Medicine. Sometimes we pay the price. You know, the reward for being an innovator is not a Nobel Prize in most cases. It's a slap in the face. So we're going to help despite risk to personal health. Good morning, everybody. It's Dr. Petteruti here at Intellectual Medicine, coming at you live from the voice of Southern New England, WPRO, the place where smart people go to get their information. Well, listen, I'm glad you've tuned in. Today we're going to be talking about some very important topics. We're going to be discussing a preventable cause of over 400,000 deaths per year, 250,000 cardiovascular deaths per year, an unrecognized toxic exposure that we're absorbing every day. And we're going to discuss not only that topic, but what we can do about it. We're going to talk about the number one cause of disability in the United States. And it's also one of the leading causes of disability in the military. And we're going to highlight what can and can't be done about it. And finally, and Shannon, do not let me forget this, because I forgot last week, we're going to talk about those two antibiotics that can kill you, that can lead to death, and ways to avoid being exposed to them. How do you engage your doctor or your nurse practitioner in a manner to protect you from consequences of Orthodox medicine? Well, here we are, Intellectual Medicine, where we explore ways to help you live 120 youthful years. That is our aspirational goal for you. 120 years sounds pretty good as long as you get to live them youthfully. How many times, Shannon, do we have people say to us, you know, I want to age gracefully? I'm not quite sure what that means.
I don't think as much anymore. I think definitely in insurance. I think now, you know, our clients are more like, all right, come on, what do you got?
Well, we know the traditional arc of aging leads to, well, infirmity before death, right? Here's your natural life arc, folks. You are born, you mature into sexual reproduction, you have offspring, and what happens next? Well, you wither and die. There's no real purpose for you after you've raised your children to the age of consent. There's no Darwinian biological purpose, but, you know, I kind of like being alive, and I kind of like not being old. So we now study, and this is the thing that I find most compelling. From our vantage point, in the front seat of medicine, we can see where the science is happening And our objective, Shannon, our objective is to bring it to the people right now. I don't want to say tired, but it can be very frustrating to live at the cutting edge. I remember, Shannon, it was in the 1980s when I first started treating obesity as a medical condition. The late 1980s, I recognized that obesity was not a consequence of lack of willpower or ignorance. You know, there I was at North Post Clinic taking care of soldiers that were overweight, men and women in their prime, exercising every day, controlled diets, and they were about to be thrown out of the Army, thrown out because they were too heavy. Maybe we should get a class action suit against that for discrimination, right? Discriminating. And I used to say this, Shan, they had these like little skinny dudes running 2-mile races, and they were fine. And these big husky men and women thrown out because they were too heavy. I said, look, dude, I want you next to me with a big bazooka on your shoulder when we're in a firefight. I want a little skinny guy with his track shoes. I get shot him in a mud hole. You think a little skinny 130-pounder is going to pull me out? I want that 220-pound guy that they're going to throw out of the Army because he's too husky. Ridiculous. Anyhow, I recognized then that it was not an absence of willpower. And I was proven right. Because in 1994, Tommy Wadden, a behavioralist out of the University of Pennsylvania, published his meta-analysis looking at over 30 different studies. And you know what he found about diet and exercise, Shannon? What do you think?
Let me guess, they don't work?
They do not work. None. Zero. None. They don't work. They've never worked. They never will work. It is like trying to stop the rain by putting up an umbrella. It's a temporary intervention in a permanent medical phenomenon. Now, we implemented the treatment that we now do successfully at Intellectual Medicine. Back in the 1990s, before Tommy Wadden's paper came out, we were proven right that it's a complex, folks, the most difficult thing you'll ever do in your life is to lose weight and keep it off. And we're going to tie this into the other issues today, by the way. The excessive death rate that's happening out there, the diabetes, the heart disease. Rhode Island in the nation is under an epidemic of preventable disease because of neglect of the leaders in medicine. Now, we can't wait for them to get it because they're not gonna. They're not going to get it. That's why you need to take action individually to affect your health. Look, do you think some of the hardest things to do are the unpopular interventions that have long-term benefit at short-term consequence? When you make and I'm for this, by the way, I don't, $1 billion, $2 billion, whatever it takes, make all the schools in Rhode Island magnificent. All of them. These decrepit buildings falling apart, it's awful. There's no immediate benefit there, folks. You got to write the check, but you cultivate a better future. Now, Shan, you know, they're protesting, as well they should, offshore oil rigs in Rhode Island. Can you imagine being down in Westerly and looking up and seeing an oil derrick?
No. What are they thinking? It's like,
okay, what they're thinking is we are hooked on oil, folks. We're hooked on oil, and it's producing toxins that are killing you. We're going to talk about that in the next section. The preventable toxin that's killing you. So we're trading our health for oil. We've been doing it for 100 years. The short-term solution is to build more refineries. Let's build one. Let's go up in Burville and build another one. The long-term remedy is to buck up, just say no to the oil. You know, we're doing some renovations in our little chateau, little house down there in EG, and we wanted to get some bluestone for this patio. You know where the bluestone's coming from, Shan? You know where they're getting it nowadays?
No. Where?
Which country? Not the U.S. anymore. It's in China.
Oh, that's right.
Yeah, because they're blowing up all the bluestone for fracking. These are the unintended consequences. They're blowing up all the stone so they can frack oil, so they can pollute your water, so they can dump pollutants into the air. Here we are on the cutting edge. We were right about obesity. We were right about chelation. We were right about lead. Intellectual medicine is a place to go where you can get the benefits of advanced care right now. And the open house is coming up, Shan. Dr. Michael Souza,
it is.
Intellectual Bay of East Bay. What's happening?
Next weekend, right? The 31st, 4 to 8 in East Providence.
4 to 8?
Yep.
What's he got going on over there?
He's going to have wine and hors d'oeuvres, and you can get a Power Pack trip, $99. Come and check out his space and meet him and, you know, what we do at Intellectual Medicine.
So the Power Pack drip, folks, is one of our most popular drips. It is a mixture of vitamins intended to enhance micronutrient health And many of our patients have noted profound benefit with their overall energy level. There's also a glutathione in that, a powerful antioxidant. But listen, when we come back, the number one, in our view, preventable cause of death in America and what you can do about it. And after that, the leading cause of disability, guess what it is? And those two antibiotics that you should be very cautious with. We'll be back in a moment. I'm Dr. Steve Petteruti. This is Intellectual Medicine.
Voice of Southern New England, WP.
Hey, Tessa, what's your call about? I'm having trouble hearing you.
It said allures are like
I don't know yet. I'll ask though.
supposed to
You can hear
really
it over
hurt.
here.
It was supposed to hit the mayor right between the eyes. That's the sign. That's
You can
a
hear her
teacher?
in the overhead.
Come on.
Oh, okay.
The Tara Granahan Show, weekdays 9 till noon.
you turn
After
it
Jim
down anymore?
Felicenti.
Yeah,
I'm
okay.
not sure, but I will ask.
Yeah, Chen, what do you want to do? Do you want to have them? No, let's. What we're thinking about is having the question transcribed by you to me, and not necessarily putting the caller on air. It's just in the interest of being more time efficient. Let's experiment with that this week. And if the caller's like of compelling interest, I suppose we could draw them in. But usually, the question itself will trigger a nice conversation.
Okay.
Want to try that?
All right. Yes,
Okay.
sure. Also, you've got a specific segment coming up too, right? So I'll just.
Yeah, we're going to be talking lead next segment,
Okay.
so that if we want to then re-engage the caller, we could call him back and set that up.
Okay. Yeah. I'll just say you've got a specific segment coming up, but I'll transfer the
Yeah.
question to you.
Yeah,
and
tell
you'll
them to
go-
relay the question to us, and we'll attempt. And if we don't answer it on air, we'll call them back after the show. Yeah. Hey, everybody, we're back. It drives us crazy. We love our seat at the front of the bus. We get to see all the cool stuff that's happening out there. We bring it to the benefit of our patients right now. You know what our reward is for that? Yeah, patients with great outcomes. Number one, happy patients. Enormous satisfaction in the work that we do. And we get a lot of accolades from our colleagues in Orthodox medicine. They are very proud of our pioneering work.
You can say
They-
that more sarcastically.
They applaud our innovation. No, listen, innovation is punished universally. I think it's one of the universal truths of mankind. I think it was Einstein who said, any new idea that is not at first thought absurd isn't worth it. Something to that effect, paraphrase. So a lot of what we do, some of it's novel thought, and some of it is really a concentration and a distillation of accumulated knowledge. That's what we've done with weight loss. That's why we succeed when everybody else fails, because we have not quit looking at the possible solutions to the problem. And you know what? When you don't quit and when you continue to search, you often succeed. And such has it been for us. Now we're pivoting that to the arena of toxic heavy metal and lead. It is our firm feeling that amongst the cornerstones of anti-aging, we have to replace hormones. We must do this, people, to preserve your bone, your muscle, your brain, your genitalia, your immune system. One more minute. And if you don't replace your hormones, you're going to suffer. You're going to wither. It's guaranteed. You want to live at your best weight. Now that's a different number for everybody. You can't go by those MetLife charts. You know those things. Remember those things?
Yeah.
I think I should weigh like 170 pounds. It's like 170. I haven't weighed 170 pounds since 7th grade. Then you must detoxify your body, especially from heavy metals, lead, cadmium, arsenic. We're all exposed. We're walking through a sea of it every day. And it's not hard to do. You just have to have access, knowledge, and a commitment. I'm just looking at the TV, noticing that there are more problems in Mexico with tourists. Right?
You hear that the family of 4 they just found dead in the condo?
I read the headline. Of course, my cynical first thought was they were drug dealers, but that is a family of 4.
Yeah, 2 little kids.
We're coming back.
Now, back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
Yeah, I love that riff. I'm back. Classic intro there. Tess, you remember that, don't you? She's got no clue. All right. This is our Get the Let Out section. Remember School of Rock? Did you do that movie? Yeah? Black was hilarious in it. Get the lead out, baby. That's the theme today. Yeah, baby. Get that lead. Okay, so we got to get the lead out. 400,000, count them, Shan, 400,000 deaths per year due to lead exposure. 250,000 cardiovascular deaths. Now this, folks, does not come just from me. Again, we've been doing chelation for years now, haven't we, Shan? We are the leading center for chelation in southern New England. We are pioneers in this field. We are certified in chelation therapy through the American College for the Advancement of Medicine. Chelation has been around, ladies and gentlemen, for 30 years. For 30 years, doctors like me, doctors like Michael Souza at East Bay Intellectual Medicine, have been performing chelation, an intravenous procedure extraordinarily safe, painless, that is shown to reduce and remove heavy metal toxins from your body. Now, why should everybody be doing this, in our opinion, especially diabetics? Well, from the Lancet Public Health Journal, 250,000 deaths from cardiovascular disease every year. Every year, folks. That puts it on a par with cigarette smoking as a preventable cause of death. You ever stop and wonder why? You know, how many times do you go to the doctor in America? They take your blood pressure. They say, oh, you have high blood pressure. Take this drug. Do you ever stop and wonder, why do I have high blood pressure? Why is it there, doc? And can we do anything to get to the underlying cause of this disorder rather than simply treat the symptom? In developing nations, the rate of hypertension in people over 50 is around 5%. You know what it is in the United States? We're pushing 60, 70%. It's almost universal, especially now that they lowered the numbers, right? They lowered the numbers, and now they're advocating, Shannon, that you should be on multiple drugs to treat it. They lower the target, and now you shouldn't be on 1 or 2 drugs, 3, 4, whatever it takes. Boy, how about that? How let the party start. More pills. Look, I love my colleagues in Orthodox medicine, but can we get off of the pill habit? Can we start to get to the core of issues? So here it is, folks. Lead linked to heart disease. This from Bruce Lamphere. Bruce is a researcher. He said even, quote, minute levels of lead, quote, bring the risk to the lowest measurable levels, I might add to that, in the blood. So when you go to your doctor, do not ask what your cholesterol is. Ask what your lead level is. And if the doctor looks at you quizzically and says, oh, that doesn't matter, tell him to go back to the books and you'll make an appointment in another month and see if he's educated him or herself. Now, this isn't something we're talking about in medical school. And in fairness to your doctors, those poor critters are pounded by the never-ending minutia trail. Am I right, Shan?
It is.
It's gotten absurd.
Mm-hmm.
They beat these poor doctors and nurse practitioners. The primary care doctors are all, you just have migraines. You know, it's awful what they've done to medicine. When they introduced computers, we all thought it'd be great, better for patient care. It's awful because the computers become a third eye. It's the insurance company and the government staring over your shoulder and over the shoulder of your doctor. Anyhow, we segue a bit. But the point here is that you've got to be your own advocate. You want to know what your blood level is. Now, if your blood level is 0, that's encouraging, but it's not enough. Lead gets stored in the body, in the bones, and in the cells of the body. 90% of the lead in your body is locked up in bone, where it leaches out over time and corrodes your heart and your brain. Cadmium is another ubiquitous heavy metal that causes cancer, one of the leading preventable causes. Arsenic is widely pervasive. Mercury and gadolinium. If you've ever had an MRI study, they likely had gadolinium in it, right? We were told it was safe. The FDA declared it safe. You know, Shan, the FDA did a 3-year study. God bless them. 3 whole years.
3 years.
Looking at gadolinium, and they reassured everybody, although we now know that gadolinium is a heavy metal that will accumulate in your brain, we know it's safe, right? Nonsense.
How many times do we get the heavy metals back? And they'll say, what is that from? They'll say, I had that MRI 20 years ago.
Right. right? It's in the brain, people. Look, I don't know about you, but you don't have to be a physician to discern that heavy metal deposited in your brain is probably not good. Now, here's the challenge. There's a delay between cause and effect. It takes 10, 20, 30 years for an insult in the brain to manifest itself with declining cognition. So brain injury, that's not even on the radar yet. You know, we're probably the only ones talking about it in intellectual medicine. We're used to being the first, and so be it. But regarding heart disease, the news is in, people. There's lead in the pipes that bring water to your house. There's lead in the power plants spewing out smoke through those smokestacks. There's lead in your makeup. It's in the lipstick. There's lead in some of the red wine you drink. It's in some of the glasses that you drink the red wine out of. You cannot avoid it, even if you live a pristine life. So you want to minimize exposure. Get your water tested in your home. Consider filtering that water. You want to get your blood tested, yes, but then you want to test it in your body with a provocative urine study. Now, these are done at Intellectual Medicine, both in Warwick and in East Providence. It's inexpensive. It's painless. The IV infusion of calcium EDTA is necessary because that locks onto the heavy metals and pulls them into the blood where they're filtered through the kidney and they come out in the urine where they can be measured. And it gives us a correlation of what your lifetime accumulation has been. Lead and other heavy metals accumulate over decades, and they sit there rotting you out. When we do chelation, we can remove those heavy metals and lower the level. And we now have, Shannon, we've been doing this for years, and we're accumulating our before and after heavy metal testing showing consistent reductions in level. Remember, minute amounts increasing cardiovascular risk. If you have hypertension, especially if you have heart disease, especially. Now we have to talk about lead and chelation. We feel that everybody should be getting chelated. The only question is how often. Why should a 40-year-old healthy person get chelated? Because lead rots your brain slowly over decades and increases cardiovascular risk. Because it's extraordinarily safe. Because by the time you notice a consequence of that slow toxin, it might be too late to fully fix it. You don't wait until your ankles are in water before you waterproof your basement. You don't wait until you can't find your car keys before you figure out, man, I better protect my brain. You want to live to be 120? Let's take our brain with us. And keeping you free of toxins matters. So for, as I mentioned, 30 years, clinicians like me and Dr. Michael Souza have been doing chelation therapy. And they finally, the National Institute of Health, launched a multi-center, placebo-controlled, double-blind study, $31 million. It was actually organized by Orthodox medicine. You know why they did it? Because they were excited about a new innovation in healthcare that didn't involve drugs and pills. And they were curious about something that they themselves didn't do. No! They did it because they were hoping to put a bullet in chelation. Once and for all, they're going to prove that this hocus pocus didn't work. So lo and behold, they did the study. Little problem on the way to killing chelation. It worked. It worked. Profound benefit in people receiving chelation. Reduction in strokes, heart attacks, in interventions, in repeat events, in people who had been chelated. Now, there's more work that needs to be done to discern why that happened, but the results speak for themselves. The fact you haven't heard about chelation is an indictment of our current medical system. It's negligent to the diabetics out there and others who have had heart attacks who could be benefited immediately. We should be extrapolating this benefit to others at risk who have yet had an event. Based upon the TAC trial, 1 out of 25 individuals treated had a reduction in cardiac events. So let's do some quick math. There are 30 million diabetics in the United States. Diabetics have a 68% rate of heart disease. That means 20 million diabetics with heart disease. Based upon the results of the TAC trial published in a major medical journal, validated through double-blind placebo-controlled, every 25 people treated, there was a reduction of one event, one stroke, one heart attack, one unnecessary death. That means that of those 20 million diabetics, we can prevent 816,000 events by giving them this inexpensive, safe intervention. I might add that in this study, Shannon, they found no complications of significance. Why is this not universally applied? Well, it is at Intellectual Medicine, folks, and if you're a diabetic, it best behoove you to find out more about it. And for the rest of you, I recommend it as well in a less intense manner. But when we come back, what is the number one cause of disability in America? And those 2 antibiotics that can kill you. But next up from the Revolution Soft Wash News Center, the news with Doug Lizette. Doug, what's happening out there?
Good morning, doctor. Investigators are working to
Okay, so it gets me a little bit worked up.
the terrorism
Oh.
drove a flaming mid-
Yes, I can hear you.
Questions were, the first one wanted to just know like the average cost of what it would be to be treated by you as like a new patient. And we got another one. A woman's son is taking lithium and risperidone for bipolar. She would like to know about both of those, but more about the risperidone.
See,
Okay, thanks.
hearings Friday determined
Well, we could talk about those in a general term about the treatment of bipolar and the consequence of obesity with regard to the drugs, and the lithium. We could talk about that in its neurocognitive protection. The other one about cost of treatment,
do a consultant. It depends.
right?
Consult, I just do the consultant.
Should we just tell them cost of consult? Okay, I'll pitch to you. So there I was. I was on my some would say my soapbox, but I consider this my public advocacy position, that we want to educate the public about their options. We want to let them know what can be done, that the science is here. It took 30 years for them to do this study on chelation. 30 years. How much longer before people have the opportunity to benefit? They can benefit right now. We're going to wait another 30 years to prove that chelated people have less dementia?
So, I have a question.
Yeah.
How can we find out if we have lead in our makeup or in our home?
Wow, great question. Lead in the makeup or in the home? The short answer is it can be impossible to find out if it's in your home, in the air. Very hard to test. However, you can test it in your water. Doctor's Data is a laboratory. Doctor's Data, DOCTORS Data, DATA. And if you Google them, they can send you a home kit where you can test the water. Now, I recommend having the testing done by an independent lab, not the lab that's selling you the filter kits that they want to put in your home. So you can find out if there's lead in your water. That's one. The more important thing is to find out what lead is in you. So blood test, yes. Heavy metal test, yes. Now, the heavy metal test is inexpensive. Shan, what's that run people about?
It's like 140-ish.
So for about $140, you can find out how much heavy metal is in your body.
There are great websites to go to find out how much lead is in makeup.
Oh, really?
Yeah.
Websites.
Yeah, if you literally Google like makeup and lead. I remember when Ava Anderson was like really big. Do you remember her?
No, I don't.
Oh, she was like the 18-year-old, and I think she was in Rhode Island.
Okay.
There was this whole sheet literally told you like all the makeup, and because they were like a natural company.
Right.
So you can Google it and.
So you can Google lead and makeup, and they'll come up with a listing. Now, there are companies that promote themselves as being non-lead in their makeup. Am I right, Shan? You can find non-lead makeup.
Oh yeah.
Yeah. So
Major companies.
I also think, folks, I'm very cautious about where I buy, what country manufactures the things that I buy that go into my body. I don't buy anything from nations that I don't feel have high standards. I feel confident with things from the European Union. I feel confident with things from the United Kingdom and from the United States. And Canada. Canada's okay. That's about it, though. I don't think I'd buy things from other countries.
No, definitely not.
Yeah.
China and
Yeah.
they're certain.
They need to prove it. I mean, they need to prove it to me. China needs to prove it to me. They were poisoning their own people. What did they put? They had lead in baby food, didn't
Yeah.
they? In a formula?
There's lead in our baby food too.
Well, that, yeah.
I mean, from the dirt. It's not like
Yeah.
they're putting it in it, but.
Yeah, the lead is every place. It's in your food. You can have organic products with lead in them because the lead comes up through the soil. Has nothing to do with eating inorganic. Does not protect you from the lead exposure. Yeah. So avoidance, yes. Not avoidance is too strong a word. Minimizing exposure. That's the objective. Avoidance is impossible. We kind of ruined the planet, and now we got to deal with the consequence for the next several decades till we can clean it up. Another question coming there, Shan?
Yeah, I got it. I can't read.
Okay. We need to get more access to chelation for people looking to extend.
Which is worse, starting a business in a
How often should you test? Oh, detox. I can't read.
Well, there are a few ways you can detox the heavy metal. One is with saunas. Actually, you can sweat out some heavy metal. And in countries that do that, the Nordic countries do this as a routine. They'll do it 4 or 5 times a week. Problem I have with that is getting access to a sauna and time. I don't know. I can't sit there and sweat for 30 minutes. In our practice, we advocate monthly infusions of chelation for general purposes, for reduction of heavy metal. And we have noticed with that approach, over time, reduction in heavy metal loads of individuals. The younger you are, the more benefit you can gain because you have a longer timeline of removal. That also can help to prevent reaccumulation. Now, monthly is my recommendation. If you're younger and healthier, can you go to every other month or once every 3 months? Possibly, yes. We don't have the before and afters yet on that approach.
30 seconds.
Oh, okay. But that's my my general recommendation. And then the intensity of chelation, how much calcium EDTA do we recommend putting in that drip varies based on individual as well. I think this should be part of what folks do. Just kind of how much does a chelation cost? What's the ballpark on
About
that?
$170.
About $170 to get chelated. So you do one every month or two. Small money. Place is beautiful. Sit there and chat with nurses. We're about to come back on. All right, we're back, folks. It's Dr. Petteruti here with Shannon, WPRO, the voice of Southern New England. We are channeling the spirit of Dr. Michael Souza over in East Providence, about to open up. Not open up, he's been open. He's seeing patients. East Providence, his open house is going to be Saturday the 31st from 4 until 8 o'clock. There'll be hors d'oeuvres. There'll be wine. There's going to be music, Shan. Did you know that?
I did not know that.
There's going to be music.
Fancy.
And there's going to be the power pack.
There is.
And you can also get a wingman if you want.
Of course.
The drip before you sip.
That's right.
To reduce toxic effect of alcohol. We are not advocating drunkenness. Please spare me the criticism, you puritanical goons. We are saying for reasonable adults enjoying some adult beverage, this reduces toxin. While we were on break, a couple of questions worthy of addressing. One was, how can I find out if there's lead in my makeup? Shannon, how do they do that?
It was great. There's some great websites out there. If you just Google lead and makeup, there's charts and comparisons, and it tells you the amounts and what you're using.
Okay. Have you ever done that?
I have not, but I've seen the lists.
So you're telling me you don't really care about your brain. Is that about it?
I know mine doesn't contain lead.
All right. So let me pose this question. If there were makeup out there that would absolutely enhance your beauty, but totally had lead in it.
Ooh. I totally use it. I chelate more often.
I just chelate more often. Beauty today is better than a brain tomorrow. Is that? All right. The other question, so that was about lead. Now you can get your water tested. The company we use often is called Doctors Data, DATA, first word doctors. And as always, people, we like to emphasize that we are not sponsored by anybody. The companies and things we recommend, we do so because we believe they have value, not because we get paid. We're trying to change that, and we'll keep you posted. Anyhow, you can Google this company. They can send you a home testing kit for your water. I like the idea of having it independently tested rather than from the company that will sell you the filter. Some great companies in Rhode Island that you can go to get water filtering. But don't forget, no matter how much you try to minimize your exposure, it will happen. Organic foods have lead in them because it's not inorganic and it comes up through the soil. So yes, you must chelate. Now the recommendation from intellectual medicine on average is 1 per month for average healthy people, sometimes every other month. The cost of that is around $170, so it's inexpensive. Now we did have a call while we're on the air. Somebody wanted to know, how can they come to see me or Dr. Michael Souza? What does that cost? Intellectual medicine has a variety of approaches to address your needs, one of which can be the concierge anti-aging primary care, where intellectual medicine either Dr. Souza or I can become your family doc, where we direct the whole gamut of anti-aging. However, we're available to you as a consultative encounter to reflect upon the best way to use our resources, whether it's chelation, weight reduction, facial anti-aging, hormone replacement, all the cornerstones of anti-aging. Shan, how do people do that if they want to just do a consultation?
They do a consult. Just call the office. Or they can call our 1-800 number now.
Yep.
833-IM120-GO and choose which office, either Warwick or East Providence. It's $275 for a consultation, and I think that's the best way to, plan with you or Dr. Souza and figure out what the best way.
It's an experience like you've not had in medicine. It's an hour-long conversation. Your body will be analyzed as a routine part of that, looking at percent body fat, because we believe so strongly that controlling your weight is a foundation piece of anti-aging. So much else ties into that. We talked a lot about lead, and it deserves to be talked about in part because we're the only ones doing it and because it's being neglected by Orthodox medicine, just like obesity. If your doctor, if your neighbor, if your nurse practitioner, if your nutritionist has ever told you to diet and exercise to lose weight, they're telling you they know nothing about weight loss. They're admitting ignorance because that, folks, has been proven multiple times in multiple studies to not work. Now, we asked the question, Shan, before the break, what's the number one disability? And the answer is low back pain. Now, that's a big dilemma because coupled with low back pain being the number one disabling condition in America is the sad fact that conventional medicine has nothing to offer you. Nothing works, nothing. Drugs do not work. Injecting the disc with these imaging studies that they do, the little intrathecal disc injection of steroids, does not work. And these are studies validating lack of efficacy. Now, you may notice some short-term benefit, folks, but in the study looking at the disc injections 3 months later, the pain came roaring back. Radiofrequency ablation of the nerve, where they go in and they kill the nerve, the theory being you kill the nerve, you stop the conduit causing pain, didn't work. Starting to look kind of hopeless, huh, people? Well, the reality is that low back pain is a common denominator for a domino of risk factors that lead to the condition. You're better served addressing this in a globalized manner, the intellectual medicine approach as embodied by other doctors as well. Now, intellectual medicine certainly possesses this aptitude, but we're not exclusive to it. There are doctors out there in the Orthodox medical world who get it, and they're embracing this kind of a concept. The chiropractors get it. They're embracing this concept. The naturopaths get it, and they're embracing the concept. They're recently licensed in Rhode Island. You know that, Shannon?
I didn't.
They're on the rise.
Good for them.
Yeah, I'm welcome. Welcome to the club, guys. You be prepared to have a pie slammed in your face. Orthodox medicine does not like when outsiders encroach on their domain. Now, we know because we've stepped on toes, intellectually speaking, and the reactive knee-jerk has been, let's kill them. But, we persevere. So low back pain, that global approach, what do I mean? Well, number one, have you ever seen that skeleton? Remember in science class in high school, they had that skeleton hanging in the corner of the room? You notice how flimsy those spine look compared to the whole massive human body it holds up? Folks, it's not the vertebrae that hold you up, it's your muscles. It's like the cables on the Newport Bridge that hold the bridge up. No muscle, no support, increased pain. What builds muscle? Well, if you don't have testosterone in your body, if you're past 40 as a woman, past 50 as a man, the likelihood is your testosterone is dipping to the point where it's causing issues. And if you have low back pain, then rebuilding the strength of the lower back is critical. Reducing your weight. Reduction in fat not only offloads the stress, but it reduces cytokines, and these are inflammatory enzymes that fat cells make that cause pain. How about adjustment, chiropractic manipulation? That can have some value, and I endorse it. Imaging studies, please avoid these people. Please avoid them. I have a patient who had multiple x-rays of his lower back over the span of his life, developed prostate cancer. Listen, radiation causes cancer. Can we appreciate the fact Madame Curie died of cancer? I'm not saying you should never get an x-ray, but you sure as heck should ask why, doctor. Do I need this? Can I avoid it? An MRI, just to see what's going on, is a waste of a study. Address the issue. Get the weight down, the pain down. Now, we have to take, these breaks are coming up too quickly. When we come back, I'm going to tell you about a breakthrough treatment that can help with this low back pain. Might be the only prescription available, not commonly utilized in Orthodox medicine, but you, dear listener, you're going to know about it when we come back. And Shan, don't let me forget, those antibiotics, they could kill people. They have to know this information. These antibiotics that can cause harm. Our job is to protect you from things that can cause you harm, including interventions to help, quote, help you with back pain, when the real solution is the long, hard approach of gradual lifestyle change, weight reduction, and strength enhancement. So when we come back, folks, the new breakthrough prescription drug that few doctors and patients know about but can help pain and inflammation, even used to help fight cancer now. And we'll be back after this break. I'm Dr. Petteruti, and this is Intellectual Medicine. We need more time. Can I tell you? It just goes by too quickly. Yeah, so back pain. Okay, so here's what you do with back pain. Number 1, don't go to the doctor. Number 2, don't go to the doctor. Number 3, avoid contact with the healthcare system. They will mess you up. Every doctor feels an obligation to do something to help you. What do you do when you have nothing that can help a patient? Well, you kind of fake it. You kind of do something. Here, take some naproxen. Okay, great. Increase your risk of ulcers, increase your risk of heart attack, and it doesn't help your back pain. But like Descartes said, it amuses the patient while nature affects a cure. Number 1 with back pain, do nothing for 3 months other than stretch, exercise, stay active. You cannot rest your back to good health. When I was in medical school, there was a doctor. He was, I'm laughing, Shane, he was retired. I say retired. He was an orthopedic surgeon who no longer operated. And he had aligned himself with attorneys in the area. And he was widely known for treating low back pain. You know what his treatment was? He'd put you in the hospital for 3 days, 3 days in a hospital at total bed rest with traction on your lower back. So you just lie there with this apparatus pulling on your lower back for 3 days, followed by keep you out of work for 6 months, have all these treatments, no benefit. You know why they did that? You know why. Jack the bill. Jack the bill. These are car accident cases he generally saw. And by the time he was done futzing with these patients, their bill would be in the 6 figures, $150,000. Now, we know lawyers get paid a percentage of a settlement, and the fender bender ain't worth a hell of a lot unless you can rack up medical costs. And here's how that game still plays out today. $150,000 medical bill, the lawyer gets a chunk, the doctor gets a huge chunk, you get pennies. Don't play that game. Don't play it to yourself. So you get a back injury, step 1, look at the sequence of triggers that got you there. Do you have a regular routine of physical activity that includes stretching and core strengthening? If the answer is no, then bring that on board. Are you at your best weight? If the answer is no, don't waste your time. Just come either see me or Dr. Souza. I hate to appear self-serving, but there's nothing else out there quite like what we do. And these diet and exercise things fail. Look, okay, if you have to lose 10 pounds, go for it. But if you need to lose more than 5% of your body weight, your probability of success in the absence of an aggressive, multifaceted treatment approach like ours approaches 0. So you do those 2 things, folks, then you wait 3 months. Well, suppose you have bone cancer, right? That back pain could be bone cancer. Okay, so here's the lowdown. If you have bone pain from cancer in your lower back, it's going to get worse and worse over those 3 months. And there's no real hurry to diagnose it because, horse is out of the barn. You got bone cancer, dude. It's not a great play. The treatment will be as effective in 2 months as it would be in 1 week. The probability of your low back pain being cancer approaches 0 if you're under 50 and doesn't go much higher than that if you're over 50. A little bit different if you have a prior history of cancer. Now, I'm talking about classic low back pain. If you've had cancer and you're having bone pain, you should see your doc. That's a different kettle of fish. But the take-home message about low back pain, go slow, go slowly, and avoid intervention, and by all means avoid surgery. Surgery does not affect any benefit to low back pain. It can help sciatica in some cases.
To Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
Yes, folks, it would not be intellectual medicine without a riff from Cake. Thanks, Tess. I am smiling over here. It's going to be a great Saturday. Okay, well, I don't know why. I just love it. It's just, are they still even around? Good job. We did it, and it just filled me full of adrenaline. Not that I needed much today, but it was still very, very exciting. All right, so we're back, and we're talking about how to protect you. Let me get to these two antibiotics, and then we'll talk about the mumps immunization. I think this is worthy of some highlight. Biaxin. Clarithromycin is a generic name. Biaxin's been around for quite a while. It's commonly used as an antibiotic to treat infectious diseases. It is often used by doctors in the face of a cough illness. Now, here are a few key things you need to know. It will help you to know. I hate that phrase, you need to know. You don't need to know anything. You could stay the way you are. God bless you. We love you just the way you are. But it will help you to know this if you see your doctor. Cough with production of colored mucus does not mean a need for antibiotic. Unless you have chronic lung disease, emphysema, if you're an otherwise reasonably healthy human being, this is overwhelmingly a viral infection, folks, and antibiotics can cause you harm, and they do nothing to speed your recovery. At Intellectual Medicine, we advocate the use of letting your body heal these illnesses. Now, we offer IV infusions to assist with that process. They're intended to help enhance elements that are known to have value regarding your immune function and may have the capacity to help reduce the infection itself. But please be careful. Biaxin had an increase in deaths in patients with heart disease. How do you know if you have heart disease? Check your pulse and look in the mirror. If you're an American, you got heart disease. I'm being a little bit facetious. It is so ubiquitous and it is so often undiagnosed. Another antibiotic known to cause harm, quinolones. Remember when these came out, Shan? They were the bomb, right? Cipro.
I think they were out already.
Levo-
Might be a little before my time.
All right, well, oh, there you go. Ooh, okay. There you go again. So when quinolones came out, I remember when ciprofloxacin was a new kid on the block, and we prescribed this sucker like candy. Cipro for everybody. It killed bacteria. It was great for bladder infections. You know what we're finding out, folks? It degrades collagen. Turns out collagen's kind of important. That's the stuff that makes up your tendons, your ligaments, the soft tissue in your body. And a few years ago, the FDA put a black box warning for all quinolones, Cipro, Levaquin, Avalox, and it was about tendon rupture. Achilles tendons were blowing up. In older people especially, older people have compromised collagen to begin with. The other issue is that it would degrade collagen. Now we're finding out an increased death rate from aortic aneurysms in folks on quinolones. A study published in the American Journal of Medicine out of Sweden correlated it. So how do you deal with this? Well, if you go to your doctor for an illness, let him know that you have an intellectual medicine philosophy. You don't have to utter those words, but rather say this: Doctor, I'm here to get myself evaluated. I just want to make sure that I'm not in jeopardy of becoming ill to a point that threatens my life. I do not want an antibiotic, dear doctor or nurse practitioner, unless you feel it is absolutely essential to prevent a horrible outcome. I don't want the antibiotic. If the antibiotic has a chance to help, but maybe it won't, I am comfortable with waiting this one out for a few more days. Now, if you orient your doctor in that manner, you will help to color the encounter your doctor or your nurse practitioner is going to know your philosophy, which is, hey, I'm a medical minimalist. I want you to check me out and make sure I'm going to be okay here, but I'm comfortable waiting on this, including avoiding chest x-rays if at all possible. So avoid antibiotics, number one. If you need an antibiotic and you have heart disease, be careful about Biaxin and be careful about quinolones. You're better off using the earlier, older antibiotics if they're needed. And more often, you don't need an antibiotic, but a nice IV drip can help enhance your well-being as you're healing. Now, I want to talk about, so we got to protect people, Shan, from Orthodox medicine. You know, the first thing your doctor usually thinks about when a doctor enters a room, the first thing they're thinking about is, how can I get out of this room as fast as I can? Studies have shown that the average doctor listens to the patient for approximately 14 seconds before they interrupt them. Most doctors have already made their diagnosis and assessment and plan within 60 seconds of the encounter. That's in part due to their wisdom and experience, yes, but also due to time pressure. They don't have time to listen to you tell the story. The clock's ticking. They're getting paid by the piece. The state of medicine is not what it once was. That's why Orthodox medicine intellectual medicine was born. Now, we had a caller, Shannon, ask about that. Did we tell him the price for the consult? You already did that. Okay, good. To the caller that asked about drugs for bipolar, I do want to address them in a global manner. Bipolar is a horrible condition, hard to treat, and oftentimes Orthodox medicine, treatment by psychiatry is critical to help stabilize a condition. One of the problems with those drugs is many of them, almost all of these antipsychotics that are commonly used, are profoundly obesogenic. They cause accelerated obesity. They can interfere with libido and sexual function. And as such, these side effects can amplify the misery of the patient. Therefore, we need to consider being proactive. And we work in many cases in parallel with our psychiatric colleagues to mitigate those side effects by controlling the weight, by intervening in a manner to support energy and sexual vitality. With regard to lithium more specifically, this drug can be powerfully effective. It can also be profoundly obesogenic, and it can lead to some kidney complications, so it does need to be carefully monitored. But did you know, Shan, that studies have actually correlated lithium with decreased dementia risk? So we've extrapolated that information, and some people in the intellectual medicine world are using low-dose lithium to help prevent dementia. I'm not advocating you go out and get lithium prescribed by your doctor. That's a therapeutic dose, but you can get it as an over-the-counter supplement in some cases. Well, let's talk about, we got a couple minutes left, and before Tony DeJesus, the sage of the big blue bug, it comes on and tells us how to keep our homes safe from mice and other critters. I got to talk about the mumps immunization. So here's news. They have found out that the mumps immunization, the MMR shot, the mumps that you had back when you were 4 to 6 years old, 25% of you have had lost its effect after 8 years. So we can interpret this a couple of ways. Number one, you need to get more shots. You should get your mumps shot every 8 to 10 years. Or number two, damn shot never worked. It didn't work that great. Now, to put this in perspective, so they've come out with this recommendation that you should get another mumps shot when you're 18. Now, here's the math on it, folks. In 2017, there were less than 6,000 mumps cases in the United States. Assuming all of those cases occurred in 18-year-old individuals, which of course did not happen, but let's make that assumption. That means there are 30 million 18-year-olds in America, or the rate of mumps in 18-year-olds would be, you ready for this staggering number, 0.0002%. And because of that risk, we're going to immunize 30 million people. Now, I am not an anti-vaccination zealot, but I am an intellectual medicine purist. And Shan, that don't seem too intellectual to me, that we're going to immunize 30 million people because of a 0.000, probably put another zero in there when you get right down to it. Better to keep your immune system functioning well. Maybe we should make that a theme for next week. So today, folks, in recap, we talked about the need to get the lead out. Chelate, and chelate some more. If you're diabetic, run, don't walk to intellectual medicine and get on this. We talked about avoiding antibiotics, Biaxin, quinolones. We talked about, what else did we talk about, Shan? Low back pain, avoiding Orthodox medicine. We're here every Saturday morning, folks. I'm Dr. Steve Petteruti along with Shannon. This is Intellectual Medicine. We are wishing you 120 youthful years. Hey guys, thanks for tuning in. Hope you enjoyed it. Share this with your friends and neighbors. Intellectual medicine is a movement that you possess. It's a grassroots endeavor to make people live better and longer, to ask why we can't live younger, why we shouldn't pursue 120, why is Orthodox medicine still putting out fires and not helping you stay healthy. That's our mission, and we'll be here every week to move it forward. Thanks, folks.